statistics. All right, really has nothing to do with pregnancy, or I just put it in my reproductive thing because it's a very short thing. It's like 5 slides, if that. But I really want to close off the whole course by talking about this, because this is stuff you really need to understand and why the changes are occurring, or asking yourself why the changes are occurring. So basically, this is what it is from 2015 from the CDC, all right, Centers of Disease and Control. Let me also tell you, too, 2 organizations you should definitely know about if you don't know already. CDC. CDC is a Center of Disease and Control, okay? But it's for the United States. The CDC, whatever they say, if they make some kind of headline in a newspaper, listen to it. It holds water. They've done the studies on it. They've been doing the research on it. They know what they're talking about. You have to listen to what that says, because that's going to also change the management. The other big organization that you definitely need to know is, it looks weird, but it's WHO, the World Health Organization. Okay? They don't pronounce it as WHO. They say WHO, or World Health Organization. This is the whole world. And they look at epidemics that are happening with the United States, Canada, Asia, wherever. And they look at these things. Okay? These 2 programs, or 2 organizations, World Health Organization and the CDC. World Health Organization is for the whole world. CDC is just for the United States. These will hold water in any kind of court of law. Okay? These are the things you want to listen to. What other people say, doctor says this, or a nurse says this, or a researcher does this, put it in the back of your head and just keep that in mind. But CDC and World Health Organization, there's a lot of validity for those 2 organizations. Okay? Now, I got this from 2015, and these are the top killers in the United States as of 2015. You need to know them for my exam, and you need to know them for your future in order. You don't have to worry about the numbers over here of the thousands that died, but you need to know the order over here. It's crucial, because 10 years ago, these were going in they're in a different order. And I want you to see what's going on, and I want you to ask yourself, why are they changing? Heart disease has been #1 for decades, okay? They actually thought that this year, or actually 2016, that they would flip over. In other words, cancers, I forgot what it was. I think, you can see how close they are. I think cancers just broke 600,000, and these numbers over here went down to like 609. They thought that cancer would actually be #1, but it didn't. It still remained the same over here. Okay? But this is the things you need to understand. If cancer becomes #1, what's going on? Does that mean we are not doing cancer screening properly and people are dying from cancer more? Or are people not taking their medications properly, they're non-compliant? Or on the other end of the spectrum, are we treating people with heart attacks better and they're not dying from it and those numbers are coming down? Do you see where this is going? These are the questions you should be asking yourself for your future. Stroke, for a long time, was #4. But for the past 4 or 5 years, accidents have been going up. Does that mean that we're treating strokes better, that they're not dying from it often? Or does that mean that we're seeing a lot more accidents? Now let me tell you what accidents are: unintentional injuries, motor vehicle accidents, alcohol, Drug abuse. And you know that's making big news now about drug abuse. Right? You're going to see this number start creeping up. These are the things you've got to look at. All right? Chronic lower respiratory diseases. COPD. Why would you think that maybe chronic lower respiratory disease, maybe the next 5 or 10 years, that's coming down? Why would you think that's coming down? Yeah, decrease in smoking. You see how you're starting to think this way, right? We don't see heavy smokers. We had the heavy smokers happening, you know, when they were from World War II. They came back. They, you know, I mean, in the 1970s, there was, I saw TV commercials and you know, and ads, billboards. You know, they want you to smoke Camel because that's what your doctor smokes. I mean, that was the thing back then, but not much. It's difficult now. I remember, maybe you guys are old enough to understand it or remember it too. You know, when you went to a restaurant, they would ask you, do you want smoking or non-smoking, right? You don't see that anymore. You can't even smoke into you know, bars and stuff. You got to go outside. It makes it more difficult. You can't do it on campus here. So it's making it a little bit more difficult to do that. Right? You know, and this accidents thing. In Massachusetts, they just made a law where, you know, marijuana you can smoke, you know, off the street. But we know that's I get frustrated about that. I mean, we know that, you know, this unintentional accidents over here, and they're making a big thing about we're seeing drug abuse getting bigger and bigger. Then why even put marijuana on there if that's going to be a gateway drug? Why would you even have an opportunity to make that up? You know, to say that that's okay. We're going to have a bigger problem with people having drug abuse, right? Marijuana, they smoke cigarettes, marijuana, alcohol. You know, hey, let me try heroin too, right? See the problems going on here. And this is what you got to see over here. You wouldn't expect this Alzheimer's disease. That's one of the top 10 killers. That's creeping up too. All right? Diabetes is over there. Actually, I think I saw in 2003 or 2004, diabetes was number 6, Alzheimer's was number 7. And again, you ask yourself, why is Alzheimer's getting higher? Or why is diabetes going down? Is it that we're better diagnosing Alzheimer's and that's what they're dying of? We can see, we can maybe screening, we can see this better? Is it diabetes going down because we have better treatments? I don't know. But these are the questions you've got to ask yourself. You know, pneumonia's on there. Intentional self-harm. That bumped up. I think in 2004, suicides, intentional self-harm was number 11. The one underneath that was sepsis, a bacteria in the bloodstream. So that's number 11. This is creeping up. The most cases of suicide, it's a bimodal thing. Teenager years and elderly. And that's where you usually see the biggest areas of suicide. So you do need to know these in order. We'll be asked on the next exam, okay? You need to know them in order because it's the only way for you to appreciate what's going to happen in 2017, 2018. You see these numbers changing, all right? Questions about this? And this is the United States, not worldwide.
Do you think the dudes up there that are like kind of, I don't know if they self-induce, but like you can control like exercise, like diet, everything?
Sure. That's what they got to try and push. What's going to decrease?
Like the rates of some people drop down on the list. Like, I'm not saying the world.
Yeah, but then there's always something else coming out.
Yeah.
You know, that's what, if you think about it, most cases of these diseases over here, most cases, you can fight with just education. If you really think about it. You'll have the conditions, like you'll have diabetes, but if you're educated to understand how diabetes works, then you're not going to eat the wrong foods. You'll live longer, and then you'll die of something else. You'll exercise more, like we were saying. So education, I mean, think about it. Just take HIV, for instance. I mean, education's the only way to fight that. Prevention. Because once you have it, that's it. So it's education, you know. I'm for putting condoms in the high schools. They're going to do it anyway. But you don't want to kill off the kids. You see what I mean? And there's a big, you know, again, medical ethics. There's a lot of people disagree with that. But when you get into the medical field, you've got to be on your toes with this kind of stuff. You've got to know yourself. You get to know yourself on what you think is right and wrong. And you've got to appreciate everybody else's views on right and wrong. But you've got to put a stand on it, too. All right? So that's what I want to say about the 10 leading causes of deaths in the United States. Now, let's just focus a little bit on, I want you to also see this, too. This is what's going on, all right? Life expectancy right now in the United States is, CDC in 2013 says 78 years old. That's pretty good. I mean, back in the 40s, my guess is probably, 67, 60 years old, right? Things are getting better with the new medical technology that we have and stuff. The things that we can get screening, we can catch colon cancer by doing a colonoscopy. We can catch them earlier, so when they have a lot of bleeding out of the rectum, and then do a biopsy and found this stage 4 cancer, not much hope we could do. But if we catch it as stage 1 cancer, remove part of the bowel, you could live for another 20, 30 years. So things are changing. We have ultrasound. Back in the 50s and 60s, they didn't have ultrasound. There's a way to go with a lot of things, too. For instance, ovarian cancer. We don't have a screening test for ovarian cancer. And by the time they pick it up, she already has symptoms. But when you have symptoms, their belly usually gets bigger because it's filled with edema and ascites. That's already stage 3 cancer of ovaries. So it's already a late stage. So we have a way to go with a lot of different things. Okay? But we've done well with certain things, like cervical cancer. We pick it up so early because of the pap smears. So even though the statistics are from 2013, at this point of me doing this recording is 2017, so 4 years, but notice the trends of what's going on. That's what I want you to see on this. And that's what I want you to see if you're going to stay with the medical career. That's what I want you to see for the rest of your career. Not just that, but even if you change your major to become a chef or whatever, this is what's happening in the world, or at least in the United States. So, and like I said before, for example, what was once the 5th killer has now become the 4th killer. Ask yourself, is it due to medical advancements or failures, or society changes, or perhaps both? You're cutting down the smoking. You go to McDonald's. I mean, they're selling salads there, but how many people are buying salads at McDonald's? You go to McDonald's to get a burger, right? Things like that. All right? You see, Alzheimer's disease is creeping up. It's the brown line on there. Diseases of the heart you see down. Well, look at malignant neoplasias. Cancer, the gray line. It's head and head over there. Eventually, I think it's going to go higher than heart attacks. Okay? Questions about that? All right, so let's just look at cancers. And I'm not going to ask you to memorize all this. This is way overkill because we didn't talk about all the cancers. But what I do want you to know is the top 3. They're easy to know. Okay? This is these are cancers of new cancers, diagnosed cancers, not what they die from. This is when they get diagnosed. And the most common one in males and females . The most common one in males is prostate cancer they pick up, then lung cancer, then colon cancer. You should know those, the new cases. In women, breast cancer is the most common cancer that's found in women, and then lung cancer, and then colon cancer. Why are we picking up so much prostate cancer than any other cancer? Yeah, we got the screening, the prostate, the rectal exam, and feeling at that prostate. We also have a blood level PSA. We picked it up. Why are we picking up so much breast cancer? Mammograms. They're routine screening for breast cancer. Lung cancer, there's not much screening, but we do ask the patients, you're breathing well, you're coughing up blood, those things. But we also do chest x-rays. We catch things a little bit early with that. Colon cancer, why are we finding so much of that? Routine colonoscopy, screening tests, right? People over 50 years old need to get a routine colonoscopy. Colonoscopy 5 to 10 years. Every 5 to 10 years, you get a colonoscopy. If you have a risk factor, like your father died of colon cancer, then it's a little bit earlier, or if you have bleeding yourself. So I want you to know the order. Don't worry about the percentages. I want you to know the order of new cases of cancer in males and new cases in females, in that order. You should know that. Things will start overlapping over 20, 30 years, right? This here is what people actually die of in terms of cancer. We see some differences going on here. The most common cause of cancer in men, of deaths, is lung cancer. And in females, lung cancer. That's the #1 cause of cancer deaths in both men and women. But I showed you before, let me get back to that in men, prostate cancer was #1 finding, and breast cancer is #1 finding. But they died mostly because of lung on both of them. Why is that? Why are we finding, shouldn't it correlate? Shouldn't you have, if you find more prostatic cancer, they should die of prostate cancer. What? You're on the right track. You said it's easier for you to treat prostatic cancer and breast cancer. Well, why is it easier to treat? Right. I don't know if that's what you said, Mike. Oh, you're catching it early. You have screening tests for the prostate cancer. For instance, and I don't want this to be a lesson on cancer, but we have 4 stages of cancer, depending on how severe it is. Stage 1 is a very early case, easy to treat. Stage 4, it's pretty extensive and it metastasizes further on. It's difficult to treat that. Maybe 5 to 10% of people actually survive stage 4 cancer over, let's say, 5 to 10 years. So if you have a screening test for breasts, you catch it early. You catch it at stage 1, and that's easier to treat. So these people will live longer. But we don't have a very good screening for lung cancer. A chest x-ray, well, what if it's small? You can't see it with a chest x-ray. You see? So because of that, it's tougher to treat on it. Okay? So again, you should know the top 3 killers in cancer are men and women. The order, and it's switched. The last thing is kind of a fun thing in statistics. I won't ask you questions about this, but it's always a good slide to put on at the very end of AP2. Factors influencing the choice of physicians. Now, let me also tell you that these factors over here really are not just for physicians, but you can also extend it on medical professionals, which are all of you. This is what patients really care about. Look at the top three. Communicates well, has caring attitude. They care more about that than did they go to a well-known medical school. They never asked me what medical school I went to, and they're not going to ask you if you're a nurse or radiologist what school you went to. They care about, can you communicate? Doctor says he's going to pull out a piece of my brain from my nose. Can you explain to them what that's all about? Doctor says I have an ectopic pregnancy. I don't know what that is. Can you draw a picture and explain it to them what that is? And I'm not asking them to do a lesson on it. Can you draw something very quickly and make them understand it within a minute? Which goes with this one here, explains complicated procedures. Put yourself on the other side of the table, and you be the patient and not be the medical professional. Don't you want to have someone explain to you what's going on? You know, what do you mean by removing my tube? What tube are you talking about? And they listen to patients. I learned this in medical school. I was following up a patient, and this patient changed doctors. I was wondering what was going on. Very short antidote. Patient comes in with a headache, very severe headache. All right, it was a man, very severe headache, and the doctor was, to make a long story short, found he has brain cancer. Okay, and is treated for brain cancer. 6 weeks later, comes up for follow-up, still has a headache, but the doctor's reassuring him that we're making the brain cancer go away. We're using certain kind of radiation, and we're making the pain go, or we're making the brain cancer go away. He was supposed to follow up a week later, and he never did. I found out through the grapevine he switched doctors. He switched doctors because the doctor was more concerned about the brain cancer than what the patient was complaining about. The patient was complaining about a headache, and the doctor wasn't making the headache go away. He was just making the brain cancer go away. Do you see the problem? The doctor's right, he's doing that, but he also needs to do what the patient wants. You know, I'm sure the patient wants the brain cancer go away also, and it's really the stem of it all. But in the process, make my headache go away. That's what I'm saying. They want doctors and medical professionals to listen to the patients. And that's where you as a nurse or radiologist could say, you know, he still has that headache. He's really complaining about that, doc. I don't know if that's something you could, oh, he really has a headache? I didn't realize it was that bad. That's where you need to communicate. There's got to be a good rapport with all medical professionals. Right? You don't build a town with just one person. You've got to be able to different facets of medical professionals treating a patient. You've got to work together. They really don't care about if you're board certified. I mean, you usually will be board certified, and doctors usually put the big things on the wall, but they don't care about it. They assume that's fine. They don't care about how many years you've been in practice. If you could make their headache go away, if you could make their, their cancer go away, get them pregnant if they can't get pregnant, you know what I'm saying, work with infertility. If you're doing all that, that's what they care about. You know, they don't care about what medical school you went to, what nursing school you went to. All right? They don't care about that, patients-wise. To get the job, yeah, it'd be nice if you got, let's say, you got your nursing degree from Cornell or something like that. Yeah, if you want to get maybe a job like that, sure. But the patients were really you're going to see more of than your boss or your administration. Patients. Okay?